There are two ways to think about how lifestyle impacts MS. Things that contribute to the onset of MS and things that contribute to the progression of MS. Many lifestyle factors affect both to varying degrees. First, low vitamin D, which is associated with an increased risk of developing MS. Once MS has developed, people with low vitamin D levels tend to have worse MS symptoms. Vitamin D helps regulate the immune system, protects the blood-brain barrier, and may help provide neuroprotection and support remyelination. Vitamin D naturally comes from our exposure to sunlight. People who grow up in northern latitudes where there's less sun exposure, especially in winter months, are more likely to have low vitamin D levels and to develop MS than those who grow up closer to the equator where sun exposure is higher. An encouraging study found that vitamin D supplementation helps slow progression for very early stage MS patients. However, blood level of vitamin D is a marker of overall good health and time spent outdoors, so it's important to assess your lifestyle as a whole before jumping straight to supplementation. Another lifestyle risk factor for MS is smoking. It's not news that smoking is bad for us, so it may not come as a surprise that smoking is a risk factor for developing MS and a risk for MS progression. Interestingly, oral tobacco and nicotine itself have not shown an increase in MS risk. So it seems the act of smoking is what increases risk. Secondhand smoke also slightly increases MS risk, and smoking increases the risk of forming neutralizing antibodies, making MS medications less effective. Next is sugar. Diet is difficult to study, but one area stands out in the research. Consuming sugar-sweetened beverages like soda, flavored juice, and sweetened coffee or tea is a risk factor for increased disability in MS. Research shows that patients who reported drinking 2 sugar-sweetened beverages daily were far more likely to have severe disability than those who seldom consumed these drinks. There are alternative beverages that are not just low in sugar, but promote longevity and brain health. My favorites are black coffee, green, mint, herbal, or black tea, and of course water and sparkling water. Consuming unsweetened beverages can reduce the average person's sugar consumption by 40%. Just this one change can make a big impact. And finally, chemical solvents. Chemical solvents have been linked to an increased risk of developing MS, but the risk is complicated. It depends on how many different toxic materials you're exposed to, as well as your genes. Solvents are often mixed together, so we don't know which individual solvents are most harmful when it comes to MS risk. People at the highest risk are those in professions that involve regular exposure to multiple chemicals, like painters, printers, chemical engineers, and farmers. When possible, make choices to minimize your chemical exposure. To sum it up, several lifestyle factors can affect your MS outcomes, and working with your care team to build an MS-supportive lifestyle is a great step toward minimizing your risk of progression.